Hello, I'm Professor Jungbo Ho from the Department of Prosthodontics at Busan National University Dental School, Korea. Today, I'd like to introduce the JB tray, a product I developed. Currently, pre-made stock trays are widely used in clinical practice, especially for denture treatment, where an individual tray is typically used. To make an effective individual tray, however, an accurate preliminary arginate impression is essential. Normally, 5 steps are required to make a denture, but this process can be time-consuming and complex. While mastering each step is crucial for precise denture creation, the more complicated these steps become, the higher the chances for mistakes, particularly for dentists who lack experience or expertise in denture treatment and denture fabrication. After researching extensively, I concluded that reducing 2 of these steps could be highly beneficial in clinical practice. Specifically, I wanted to eliminate the need for creating an individual tray and the occlusion wax rim used in jaw relationship taking, allowing for easier and quicker denture fabrication. This led me to develop materials and techniques that would enable direct bottom molding using a tray softened in hot water. This material softens only in specific areas, allowing for localized bottom molding. Even one size can fit all patients, extending to the right anatomical border without the need for customization. The tray is made from a transparent material that enables clinicians to observe the movements of soft tissue during the impression, which is a huge advantage. I designed the JB tray to reflect anatomical contours in the edentulous areas to ease the clinician's job of capturing the oral anatomy accurately. The mandibular tray, JB tray, for example, is based on closed mouth impression technique, which I believe helps maximize suction or retention. We've incorporated the material in thickness to support this impression technique, allowing for direct fold molding within the mouth. Furthermore, the mandibular tray includes four vertical dimension rows to assist in quickly establishing vertical dimension and centric relation. Look at a case. This patient has moderate to severe bone resorption with maxillary tuberosity, hypertrophy, and extensive bone loss in the maxillary anterior lesion, a case of combination syndrome. Given that the patient lives far away, so I am aimed to complete the final denture in just 2 visits using the JB tray. When you place the JB tray in hot water, it softens in less than a minute at about 70 to 75 degrees Celsius. Please use the provided thermometer to ensure the water remains above 70 degrees Celsius. After about a minute, the tray becomes fully transparent, indicating it's ready to be inserted into the patient's mouth. Gently retract the lips, press down on the palatal area, and follow standard bottom molding techniques. Ensure adequate photo molding by actively manipulating the tray's edges for the right thickness and length. You can photo mold for 2 minutes. So there are enough times where I recommend a very slow photo molding procedure. If any areas appears too thick or extended, use scissors or cross-cut denture bar to trim them to fit. To capture the final impression, apply a silicone adhesive, then use silicone impression material, and you can take impression using the normal method of final impression. These patient's final impressions were taken with both an individual tray and the JB tray, and the JB tray provided excellent detail comparable to the individual tray. For simultaneously upper and lower impressions, you can snap off the handle of the JB tray to avoid interference. We've designed a V-cut into the handle for easy removal, like this. There's also a hole in the tray to accommodate the pop bowl for capturing the occlusal plane alignment during single jaw impression. Once the tray is softened in hot water, carefully place it in the mouth. Begin by pressing the retromolar pad area to shape it. Then work along the lingual border by asking the patient to move their tongue gently. This helps to extend the border molding. With enough time for border molding, you will be able to achieve a precise final impression. The final molded tray should have the ideal thickness and retention for a stable fit, even in patients with severe bone resorption. Final molded tray should have the ideal thickness and retention form for a stable fit, even in patients with severe bone resorptions. You have to check the proper extension of JV fork moldable board. Before final impression, 3D verification for mandible closed mouth impression is needed. When establishing vertical dimension, use the 4 vertical dimension rows on the tray to help position it correctly. If the rows are too tall, you can trim them to create a stable position for the impression. You have to check the bilateral contact of this load to the upper tray. Once vertical dimension is set, apply the impression material and insert the tray into the patient's mouth, allowing them to bite naturally in their habitual position. While you complete the border molding, for buccal molding, ask the patient to say like ooh, ee to help shape the buccal range. Slight opening and touch the upper lip with long tongue. Avoid excessive opening to prevent distortion. With good suction, good retention, this impression can provide stability even in resolved cases. However, if retention is excessive, adjustment can be made for patient comfort. In the case shown, the final impressions with the JB tray produced excellent retention and were similar in accuracy to the individual tray impression. In some cases, frontal teeth can be aligned using the JB fork if additional aesthetic adjustments are needed. When recording the bite, slightly soften eyelid wax or faceplate wax on the vertical dimension lows and let the patient bite to set the center relation position. Gently guide them to the CR without excessive force. Now at this point, attach the pop bow system to the contact point where the lip close using silicone bite taking material. By doing so, you can transfer essential information to the lab, including the occlusal plane, midline, and upper lip positions. Additionally, it provides details about the left to right parallel relationship and the campus lines for occlusion. With this information, the lab can accurately mount and align the artificial teeth. In the lab, technicians can use the pop bow to confirm the midline and lips positions. These reference points allow for precise mounting with the maxillary and mandibular anterior teeth aligned based on the pop bow markers. We can do average mounting. We can do artificial teeth arrangement based on the uh, average artificial teeth arrangement. The denture is then fabricated and checked in wax for fit, aesthetics, and functionality. I recommend wax denture try-ins to ensure proper lip support and bite alignment. Although two busy dentures are possible, like this patient, a wax denture check, is a valuable step to avoid issues with tooth position or occlusion. With fine adjustment for any overextensions or undercuts, you can deliver a well-fitted, aesthetically pleasing, and stable denture. With occlusion adjustments, we can ensure bilateral balanced occlusion and lateral movements. As you can see, this denture does not come out easily. While not every case will achieve this exact result, by taking a closed mouth impression and using the JB tray, we can create an extended, well-fitted tray that enables stable recording of the vertical dimension and center relation. This ultimately leads to a secure and stable denture. Thank you.